Good morning. This is Mo Salim with the disease reporting team at the New York City Department of Health and Mental Hygiene. Today, we are going to discuss replacing Reporting Central with Provider Reporting Interface and Secure Messenger, also known as PRISM. DOHMH is transitioning from using Reporting Central to Provider Reporting Interface and Secure Messenger, also known as PRISM, for electronic provider reports. This transition is due to take place on Tuesday, May 20th, 2025 at approximately 6 p.m. Please scan the QR code to the right or visit nyc.gov/health/disease reporting. At this website, you will receive the URL and detailed user guide on how to access and use PRISM. At the DOHMH, we have many modalities for law-mandated provider reporting. These reporting mechanisms ensure rapid public health response, outbreak management, and disease prevention. First is the provider access line, which is for immediately reportable conditions and high-risk diseases. And this is via immediate phone call at 866-692-36441 and also 866 NYC.DOH1. If the condition is not immediately reportable, then providers are required to report within 24 hours. And this is via electronic reporting using PRISM. PRISM is for reporting infectious diseases, poisonings, drownings, outbreaks, and other events. These are electronically submitted by healthcare professionals. To learn which cases must be reported immediately and which must be reported within 24 hours, please scan the QR code to the right or visit nyc.gov/health/disease reporting. The provider access line at 866 NYC-DOH1 is for immediate consultation and to report suspected or confirmed cases of immediately notifiable diseases. This includes a suspected outbreak of disease occurring in at least 3 people, an unusual manifestation of any disease or condition, or a newly apparent or emerging disease or a syndrome of uncertain etiology that could possibly be communicable. After hours, so that is after 5 p.m. on Monday to Friday and all weekend, calls to PAL will automatically be routed to Poison Control Center. Providers should request to speak to the provider or clinician on call. Providers may be required to complete an online report after completing the call to PAL. We will now begin the PRISM demo. When clicking on the PRISM link, you will land on this page. Clicking here on Provider Reporting Interface and Secure Messenger will begin the login procedure. Clicking on it will take us to NYCID. Please note a NYCID account is required to access PRISM. Previously for Reporting Central, NYCMED was used. NYCMED cannot be used for PRISM. You must create a NYCID to continue with PRISM. You can come here and click Create an Account from the NYCID website to create an account. And if you have any issues, please use Report an Issue to let us know and we will get back to you. I have a test case here, so we will continue with NYCID. On initial login, you're going to receive this message that you have an incomplete profile. The profile is missing key elements. Please navigate to My Profile to review and complete the available fields in the 4 sections. So the action buttons here are missing because I must click here on My Profile to continue and complete the profile. This is the reporter's My Profile page where you can enter the reporter information, facility information, laboratory information, and provider information. Please note that these fields shown with an asterisk are the required fields needed to continue. So I have a phone number. I will save it and then go next. For facility information, I need the name and the phone number. I have some information here, so I will just save this and continue. I can also edit if needed. For laboratory information, I can type in a name and it will bring in a specific laboratory. I can save this and continue. Please note that when using the drop-down list, I cannot edit it. If I want to write it myself and then edit it, I can also write this information in and edit it. When you type in information, you can edit that information, but using the drop-down list will not allow you to edit it. I will now continue. And this is the provider information. I can type in provider information here as well. I'm just using some saved information to continue quickly. I will now return to the home page. Once the My Profile information is complete, I can begin reporting a condition. Once the My Profile is completed, we can begin reporting a condition. We can make a correction or we can download a PDF. Please note that if you previously submitted a case before the launch date, you can click here to go back to Reporting Central and edit a report submitted before May 20th. Right now, I will just continue with reporting a condition. We are going to, you can click on the drop-down list to find your specific condition, or you can begin writing it. So I will just click typhoid fever and go with that. This page is the reportable event and facility lab provider information page. I am required to select a facility. I can use one of the multiple facilities that I've included, or I can type in my own new facility. Please note that if you type in information here as entered right now, this information will not be saved when I come back to complete my reports or my additional reports. So it is better to use the My Profile page from before to save these facilities and continue from here. Also, if I make any edits here, such as this information will not save when I come back to submit another report. Again, if you want any of these entries to save, you have to go to the My Profile page and save these entries. Only then can you use them in any newly created report. So I'm just going to select my previously saved conditions and continue to the next page. These are the basic information required for a PRISM report. I'm just going to type in some test information to continue. All the information with the red asterisk is required. So I need the patient's name, the patient's date of birth, the patient's country of birth, the patient's primary language, the patient's phone number, the patient's medical record number. In case I do not have any of this required information, I can click unknown. There is additional information required, which we do not need to include right now. Please also note that there is additional information required. That may depend on the conditions, such as for sterilization reports, we do not need the medical record number, the social security number, or additional information. For patient's borough of residence, we will go with Bronx and USA. For the address, the specific address information is required. However, I will just click unknown to continue quickly. Please note we also have a save and return later button. Clicking on this will allow me to save my information and return to it later and complete it from where I left off. This is the second patient information page, the additional demographics. What is the patient's sex assigned at birth? Does the patient identify as Hispanic? What is the patient's current gender identity and the patient's race? Please note that the circles are single select while the squares are multi-select. As you can see, it says check all that apply. Which of the following best describes the patient's sexual orientation? And what specific ethnic or cultural group does the patient identify as? We also have pregnancy status. Was the patient admitted to a hospital? And is the patient alive? I also have additional comments page where I can type in additional information or copy paste additional information from my notes. This is the date of diagnosis page for first name, last name, I'm submitting a typhoid fever case with today's date of diagnosis and illness onset. Over here, I just want to confirm I'm submitting this case for typhoid fever and continue. If the disease has disease-specific information required, that will be the next page. However, typhoid does not have disease-specific information. Instead, it has congregate risk information. So we're just going to type in congregate risk information quickly. So does the patient work or volunteer in childcare, healthcare, long-term facility, nursing home, research laboratory, or food handling or service preparation? So we're just going to type in quickly the name of the food or restaurant, the location, and the type of work. Does the patient attend or reside in any of these facilities? We can include, that this patient works at school, the name of the school, and the location. Is this infectious disease being reported suspected to be healthcare associated? If unknown, leave response blank. We do not know, so we will just continue. This is the final disease submission page. Here I can edit my response, go back and check if the information is correct, or which I will do now. So for congregate risk information, I just want to see I put in food preparation at food place in New York City. The person is working as a cook, and they also attend medical university in New York City. This looks fine to me, so we'll continue. Please note for PRISM, we do not have the details of what was reported in the specific pages as it was available in Reporting Central. Please note that there is a warning that the report has not been submitted to DOHMH yet. We need to click here to submit the report to DOHMH. This is the successful submission page. It says, thank you for submitting this report. I have a record ID. From here, I can view or download a PDF version of this report. I can modify, correct the submitted report. I can report another disease or condition for the same patient, or I can report a disease condition for a different patient. We can download the PDF and look at it. This is for, here we can see the condition typhoid fever with the record ID on the date. We have the patient's date of birth and additional information. We have all the information that we entered. We have the facility information, laboratory information, and provider information, and the congregate risk information. Now we will go back. If I want to report another disease for the same patient, I can click here and continue. Clicking here will duplicate the previous report information, all except the disease information questions. So here we have the same patient from before with the same demographic information. I'm going to continue to the next page. At the date of diagnosis page, I can click the date and the date for diagnosis and illness onset, and then select the condition I want to report. So here we will try chlamydia. Now I will continue. For chlamydia, we have disease-specific information. So for the chlamydia test, what was the specimen source? What was the collection date? And what was the test type? A PCR. What was the result? Positive or negative? I can also enter additional information. So we also did additional tests, and they came back negative. STIs also have treatment information page. So this page has guidelines for treatments and additional questions. Was the treatment given? Yes. What was given? So we gave doxy twice daily for 7 days. Started this on the 11th. Please indicate the gender of sexual partners in the past year. Was any of these patients' sex partners notified of possible exposure to STI? Yes. And additional questions. I'm just going to continue. Is the patient on PrEP? Finally, I'm at the final uh, review and submit page. Again, we don't have the details here on this page. However, if I want to go back, I can click edit response and go back and change any of my previous answers. And now I will submit the case to GHMH. Thank you for submitting this report. I have a record ID and it's been submitted. Now I can also save a PDF of this report. Say I saved a report, but now I want to go back and make a correction. To make a correction, I will click make a correction. I will need the record ID, the patient's last name, and date of birth. Please note that only the submitting reporter can access the record ID and PDF. So the previous report submitted was a typhoid fever case. This was the URF ID. Patient's last name was last name. Date of birth was. Now I'll click make a correction. And I have the case open again. I can go through the selections and make a correction of wherever I need. And then I can submit the report. In a corrected report, the corrected features will be available at the bottom. This is the following information that was changed. Thank you. I've misplaced my PDF or I need to download a PDF a few weeks later. I can click download a PDF button to download the PDF. I will need the URF ID, patient's last name, and patient's date of birth. Once this information is entered, I can download the PDF. Once the information is correct, the selection becomes green and the file will be downloaded. If there's an error, you will receive an error notification that this information is incorrect and we cannot download it. Invalid record details. Accurate combination of these following selections are needed to download a previously submitted report. Thank you. Please also note that when reporting a condition and submitting cases, PRISM also has a logout after a certain time of inactivity. Reporting Central had 30 minutes of inactivity that forced the user to log out, whereas PRISM has 60 minutes. So if you leave the screen and do not interact with any of the forms for 60 minutes, you will be logged out. Please note that when this logout occurs, you will hopefully not lose your information, where if you've entered certain information, the application will make sure and try to go to the next page. So when you click the next page, it will go there and then require you to log in again. But please note that after long periods of inactivity, you may lose your information. See a page like this, resubmit the form, or you try to go back and you hit an error, please press the refresh button to see if it will load and to see if your information is saved or not. If it is, you may continue. If it is not, you may have to enter it again. Thank you. Thank you. That concludes our PRISM demo. Again, DOHMH is transitioning from using Reporting Central to Provider Reporting Interface and Secure Messenger, also known as PRISM, for electronic provider reports. This will take place on Tuesday, May 20th at approximately 6 p.m. Please scan the QR code to the right or visit nyc.gov/health/disease reporting to view a list of notifiable diseases or conditions and learn which cases must be reported immediately via PAL and which cases must be reported within 24 hours via PRISM. And for additional URL and user guidance. PRISM support. For immediate consultation and urgent questions, please call the provider access line at 866-692-3641. For technical support, issues accessing the application, issues with the website, and errors with submission, please call the DHMH Help Desk at 212-766-4357. This is during business hours, Monday to Friday, 9 a.m. to 5 p.m. Outside of those business hours, please email helpdesk@health.nyc.gov. For non-urgent questions or to provide feedback, please email disease reporting at health.nyc.gov. Thank you.